Hi, good morning, everyone. Welcome back. This is the recording for Unit 6, focusing on stress, coping, and health. And these are the learning outcomes that I'll cover in this unit. So firstly, I'll define health psychology and behavioral medicine. We'll discuss how we can make positive life changes and the resources that support effective life change. I'll explain how stress is related to a healthy mind and body and discuss ways in which we can create a healthier body and mind. And finally, I'll explain why well-being is important to happiness. So let's start by contextualizing some of this content. So for instance, for a long time, it was widely believed that moderate drinking was beneficial to our health. So for a long time, it was widely believed that alcohol consumption or moderate alcohol consumption was beneficial to our health. And official recommendations from Health Canada were that women and men limit alcohol to 2 and 3 drinks per day, respectively. But after thoroughly reviewing more than about 5,000 peer-reviewed studies and 2 years of research, it became apparent based on work by the Canadian Centre on Substance Use and Addiction, it became apparent that alcohol consumption is actually harmful, and the Canadian Centre on Substance Use and Addiction released new guidelines for alcohol consumption, and this occurred in 2023, and these guidelines are far more restrictive. So the new guidelines are that alcohol should not surpass more than 2 alcoholic beverages per week. And so that's the new healthy, if we could say healthy drinking limit. No alcohol is far healthier than 2 to 3 drinks per week, but that's the guideline that the Canadian Centre on Substance Use and Addiction has put forth. So alcohol is implicated in loss of life, in disability, in poor health, and in fact, alcohol consumption causes as much loss of life as unsafe water and lack of sanity. So the numbers are comparable. So now we're going to look at additionally binge drinking, which based on statistics, 40 to 60% of Canadian university students partake in, does pose serious risks to well-being, including alcohol poisoning, which of course can result in death. So the main takeaway from all this is that high rates of binge drinking on university campuses are concerning, even under the old, more permissible recommendations, and the far new, more restrictive guidelines actually emphasize or highlight that there's even greater cause for concern around the adverse effects of alcohol consumption, particularly for young adults. So now we're going to look at health. We're going to compare health psychology to behavioral medicine. So health psychology emphasizes psychology's role in establishing and maintaining health and preventing and treating illness. So it is a multi-dimensional field that emphasizes domains that are unique to psychology as a discipline. So biological, psychological, and social factors that are implicated or influence human health. So health psychology is really about the role that psychology plays in an individual's and in communities' health and in preventing and treating illness. In contrast, behavioral medicine focuses on developing and integrating behavioral and biomedical knowledge to promote health behaviors, so to promote health and reduce illness. Okay, so if we want to just think about how these areas can be influential is through health promotion. So they both are involved in health promotion, which is a way to assist people in changing their lifestyle in order to optimize health, and also assist them in achieving an equilibrium or a balance in physical, emotional, social, spiritual, and intellectual health. And so the area of public health concerns itself with studying health and disease in large populations, okay? And it also concerns itself with designing interventions, okay? So it broadly studies these health and disease in large population, but it also is implicated in designing interventions for health promotion and in ensuring that all populations have access to cost-effective healthcare. So that's very important. Also, cost-effective health promotion services, as well as health behavioral resources. Okay, so now we're going to look at the biopsychological model. So this model is used within the domain of health psychology, and it examines biological, psychological, and social factors that contribute to health, disease, and stress. Okay, so that's the biopsychological model looks at each of these variables as contributors that we'll see interact with one another and impact an individual's health, the likelihood of experiencing disease, and stress. Another important framework to introduce within this discourse is the mind-body connection. So what is the relationship between the mind and the body? So the relationship between the mind and the body, according to health psychology and behavioral medicine, is that it is bidirectional. So the mind definitely affects health and wellness, but the body also influences the mind. Okay? So the way individuals feel physically may impact how they think, how they process information, how they experience and perceive their own subjective experience and the world around them. Okay, so one's health and wellness may in fact impact psychological experiences, including one's cognitive abilities, the level of stress that they experience, as well as the ways of coping mechanisms to deal with the stress. So in addition to recognizing that interplay between the mind and body, it's important to also recognize that, for instance, Indigenous peoples in Canada consider spirituality to be important in cultivating well-being. So it's important to keep that in mind, because Indigenous peoples do introduce the factor of spirituality in one's experience as being influential in cultivating well-being. So it's important to strive for inclusiveness, or to have a more holistic approach when thinking about health interventions, and to incorporate the approaches of the models of wellness that are used in other groups, such as Indigenous peoples. Okay, so this is a model of wellness that can be impactful in both research and practice. So, for instance, the Indigenous peoples have an Indigenous medicine wheel, and the 4 dimensions of the Indigenous medicine wheel are mental, physical, emotional, and spiritual. Okay, so now we're going to look at how we can make positive changes. Okay, so how can we make positive life changes? So we could talk about health behaviors. Okay, so we're going to look at models that posit the mechanisms by which we can make positive life changes, and how these changes are expressed or applied are through behaviors, right? So these are called health behaviors. So health behaviors are practices that influence our physical well-being, such as, for instance, having healthier attitudes about stress, about exercising, about dieting, about not smoking, about drinking, not drinking or drinking in moderation, and so on. So these are behaviors that can are seen in different domains of a person's life, like how they experience stress, the how they experience or how they partake in physical activity and exercise, how they manage their diet, how they manage their impulsive behaviors like smoking or drinking. Okay, so now that is the theory of reasoned action. So the theory of reasoned action does state that change requires people to have specific intentions about their behavior. So it's predicated on intentions. Okay, so they should also have a positive attitude about the new behaviors that they're considering to adopt. Okay, and they're also and their social group. So the social group that they're part of should be positive about this new behavior as well. Okay, so you can think about an example. For instance, if somebody is trying to quit smoking, but all the members of their social group are smokers, it's very difficult for a person to try to instate this new behavior if the social group is not positive about this new behavior. Okay, so again, the effective change is predicated on these factors: specific intentions about the behavior. Okay, so wanting to quit smoking, positive attitude about the new behavior, a life free of smoking. Okay, so having a positive disposition, a positive attitude towards that new behavior, and perceiving that the social group that they're a part of supports this new behavior. Okay, so now we're going to look at another theory, which is the theory of planned behavior. So this includes fundamental components from the theory of reasoned action, but it also includes the person's perception of control over the outcome that they're trying to instate. So both theories have accurately predicted whether individuals successfully develop intentions to engage. Okay, so according to this theory, effective change requires perceptions of control over the outcome. So the person must feel a certain level of control over the behavior that they're trying to introduce. So now we're going to look at the second model, which is the theory of planned behavior. And so this includes the fundamental components from the theory of reasoned action, but in addition, it also includes a person's perceptions of control over the outcome. So how much control the person believes they have over their behavior, the behavior that they're trying to inhibit and the one that they're trying to instate is very instrumental in this model. So this describes that when the person believes that they have the necessary resources and skills to perform the target behavior, this might be to stop smoking or to stop drinking. So this is going to increase their confidence and their intention to do so. Okay, so intention is is the additional element. Perception of control is the additional element that this model factors in. But one of the main criticisms that this model has received from other academics is that this does not suffice to explain why people fail to instate the healthy target behaviors. Okay, so the criticism is that the theory of planned behavior model assumes that that behavior is rational and that it's based on deliberate intentions, but this may not always be the case. It doesn't completely or adequately account for emotional, habitual, or impulsive factors that can influence behavior. So, for instance, it doesn't take into consideration that sometimes people may want to stop drinking or stop smoking, but they can't resist the urge, the cravings, the temptation, and so they're overcome by these urges to participate in the behavior again, to consume alcohol or to consume marijuana or whatever the psychoactive substance may be. Okay, so that's the main criticism for just to kind of reiterate, the main criticism for the theory of planned behavior is that there's a gap there. The intention behavioral gap has not been bridged, has not been it doesn't reconcile for this gap that people experience. They have the intent, but then they're overcome by other urges, other impulsive emotional factors that prevent them from instating the healthy behavior, and so they resume with the unwanted behavior, which is alcohol consumption or any other unhealthy behavior that they may be taking part in. So now we're going to look at the stages of change models. So this is another model. Okay, so this involves the process. So this is about a process, okay, by which we give up bad habits and we take on a healthier lifestyle. So it involves 5 steps, okay, and it does recognize it is predicated on the understanding that real change, it doesn't occur overnight. It doesn't occur in a one fell swoop or with one monumental decision. It's a stepwise process. So here are the 5 progressive steps, okay? So again, it recognizes that the stages of change, the personal change occurs in a series of 5 steps. Okay, so this model recognizes that changes take place in a stepwise process, in a gradual, step-by-step, incremental manner. And these are the 5 steps, the 5 stages that the person will go through. Okay, so let's go and look at them. The first one is pre-contemplation. So the description is that, okay, individuals are not yet ready to think about changing and may not be aware that they have a problem that needs to be changed. Okay, so there's an unhealthy behavior that is introducing imbalance in their life, is harmful to their health. They're not yet aware of it and they're not ready to think about changing. Okay, so an example could be a student who engaged in binge drinking is not aware that they have a drinking problem. Okay, so they're not aware that they have a problematic behavior that requires a change. That person is in the pre-contemplation stage. Okay, so what's necessary in this stage? The key element at this stage is consciousness raising. So this is where the goal is to get individuals to realize that their behavior is a problem. Okay, so raise their awareness, raise their consciousness around the problem. Okay, and during this time, during the pre-contemplation phase, it is not unusual for a person to show signs of denial. So they may be in denial. They may say, I have no problem. I have this under control. There is no problem. That's the first stage. Now let's look at contemplation. So in this stage, individuals' thinking shifts to acknowledge that they have a problem, but they may not yet be ready to change. Okay, so there's an acknowledgement, there's a recognition that they have a problem, but they may not be ready to change. So what's an example? Someone who binge drinks recognize they have a problem, perhaps because their drinking has affected their grades, their health, or relationships, but isn't yet sure they want to commit to stopping. Okay, so that's the contemplation phase. Now let's look at, so this is interesting because this is where they reevaluate themselves, and they may have mixed feelings about giving up the problematic behavior. Okay, they may have mixed feelings. So mixed feelings may occur because they may look at the short-term gains of the harmful behavior. It gives me comfort. It gives me relief from pain or from anxiety. It allows me to escape the problems that I have. That's a short-term gain of the harmful behavior. And they weigh that against the long-term benefits of changing. Okay, so now we're going to look at preparation determination. So preparation determination, individuals are preparing to take action. Okay, so they're preparing to take action. They're getting ready to make a change. Okay, so the person explores options and thinks about how to replace the binge drinking with healthier activities. So they may start to plan about how they will attend parties without engaging in the behavior. So you can think about, okay, what can I do if I still want to attend parties but not engage in the behavior? Maybe I can bring non-alcoholic beverages with me. Maybe I can warn my friends that I'm going to do this and ask for their support, because the social group may be very involved in binge drinking. This is something that's inherent to their way of meeting and spending time together. And so the person may say, okay, I still want to spend time, come to the party, I still enjoy it, but I'm going to bring non-alcoholic beverages and I'm asking for you to support me in this process. Okay, so that's really something the person is doing in the preparation determination phase. Now let's look at important elements for this. Okay, so this is based on self-belief. So this is the belief that the person has the ability to see the change through. Okay, and this is very important. Okay, because it reflects a level of control over their behavior, and also reflects a level of self-competency. So knowing that they have the ability to overcome the urges to fight the cravings for binge drinking, as is the example. Okay, and do something else instead, drink non-alcoholic beverages. Okay, so now we're going to look at action willpower, the fourth stage. So this is where the individuals commit to making a behavioral change and enact a plan. Okay, so they make the commitment and they enact a plan. So the description is: the person commits to stop binge drinking and enacts a plan to replace behavior with a healthier approach to alcohol. Okay, so this is consistent. There's a consistency here, right? So then the maintenance. Okay, so let's look at the important aspect of the fourth stage, which is action willpower. So this is to find ways to support the new and healthier lifestyle. So the person should look for reinforcements and rewards for making the change. So what if they give themselves some type of a reward when they forego the alcohol for non-alcohol? So these individuals are successful in continuing their behavior change over time. Okay, so they have succeeded in avoiding the temptation. This is very important. In the maintenance phase, the person has succeeded in avoiding the temptation. Okay, and so in the maintenance stage, the individuals have succeeded in avoiding the temptation, and then now they are consistently pursuing their new and healthy behavior. Okay, so they are successful in continuing their behavior over time. There's a consistency. There's a continuity of that healthy behavior they had originally instated in the earlier stages, in the action willpower stage. Okay, so this is where the person refrains from binge drinking for at least 6 months. So it does require that time period. That's the temporal requirement. Okay, so now we're going to look at, 1 second, please. Okay, so let's look at what the person is may encounter in this process. So they may go from the maintenance stage to a relapse. Okay, so the relapse describes that the person is returning to the formal problem behavior. Okay, so they may have maintained the occurrence of the healthy behavior, but then they've returned to the formal behavioral problem. So they've relapsed. Okay, so this is important because real lasting change does take many attempts. So the person may experience failure at the first trial. They may relapse. And it's important not to give up because it's just how the person can rebuild after that temporary failure. Okay, so the person may relapse. So in order to avoid relapse, the person may become aware of the types of situations that tempt them and avoid those situations. So if they're always tempted they feel tempted when they're with a certain group of people, or they feel tempted when they are in a certain physical environment, like in a bar, they may start to become aware that those are the cues. There are certain cues in those environments and being with those people that trigger that urge, that craving. And so they may become aware and just, okay, I might have an urge, a craving to binge drink. So I'm going to start to prepare how I'm going to deal with it. Because in those situations, that's when those triggering cues are present and I'm going to encounter them. Okay, so experts, those who are either mental health care practitioners, do understand that health behavior considers relapse. Do understand that relapse is normal. Okay, it's going to happen, but it's important to try anew. Okay, so the person, what experts describe is that when a relapse occurs, the individual has the opportunity to learn from it. Okay, think about what led up to the relapse. Okay, what led up to the relapse? What happened? And then revise a strategy on how to prevent it from occurring again. Okay, so important finding is that the majority of people who eventually do instate the healthy behavior permanently did not succeed on the first try. Okay, so so is the experience at each of those stages. Okay, so now we're going to look at what resources support effective life change. So one important question to ask is, what is the role of motivation in change? So, of course, motivation, based on studies, motivation is an important part to sustained behavioral change. Okay, so regardless of the area of research, change is always more effective when the person does it for intrinsic reasons rather than extrinsic reasons. Okay, so intrinsic reasons are self-determined. The person does it for reasons that are unique to their experience and ones that they have established, rather than them being established by external factors. So if somebody is receiving some type of praise for their healthy behavior. And the only reason they're engaging in this healthy behavior is to receive that praise, then the change is not likely to be effective, is not likely to be permanent. Okay? So the implementation intentions describes the specific ways in which individuals plan to institute changes successfully. Okay, so what are the specific plans, the step-by-step tangible ways that the person is going to institute changes successfully?